Suicide is the leading cause of death among young Asian American adults.
It is the only group in which suicide is the #1 cause of death. That's according to the CDC. Overall, suicide is the 10th leading cause of death here in the U.S. Joining us now for more on this is Amelia Noor-Oshiro, a PhD candidate at Johns Hopkins University School of Public Health. Amelia, thank you for being here with us.
Thank you.
The only category where suicide is the leading cause of death is younger Asian Americans. What's your takeaway? What's your read on why that might be?
Well, if you look at the data, it was actually surprising to me. Suicide is actually the lowest rate, as in number of deaths per year in Asian Americans. So it's surprising to see why is it the #1 leading cause of death. We don't really have definite data on what are the exact causes. So far, some of the research has been pointing to things like family conflict, pressures within the family unit. But if you ask me, from my perspective, as a social behavioral scientist in training, I believe that racism has a lot more to do with it than we're giving credit for.
That's interesting. Can you dive into that a little bit more, Amelia? How do centuries of stigma that this community has faced, how does that contribute to the high suicide rate, especially, specifically among those young Asian Americans, as Tony noted?
Well, I think what we're looking at is a demographic question. So right now, the majority of Asian Americans are very young. Millennial and Gen Z make up the majority of the Asian American population. And they're growing up in a world, in a society, an American society that's essentially really focused on anti-racism, right? We're looking at George Floyd making a huge impact in this generation. So we have a lot of race consciousness, a lot of racism consciousness. People, people have dinner table conversations using words like microaggressions. These are things that are becoming normalized, and people are getting kind of more aware of the discrimination they're experiencing. So sometimes it's a question of, is it that the discrimination has occurred socially stigmatized in our structures, in our policies forever? Or is it also just that we're actually perceiving the discrimination more? So scientists are kind of in that stage of figuring out, could it be a combination of both?
Wait, so Amelia, are you saying that a new lens on racism and discrimination could be changing the perception of it for Asian Americans and contributing to suicide?
Could you repeat that for me?
Are you saying that the awareness that we've all, that's dawned on this country in the last 5 or 10 years when it comes to the difficulties faced by young Asian Americans, the awareness itself is contributing to the experience of racism being more intense and maybe contributing to this suicide rate? Do I have that right?
So I appreciate the question. I think that could be one factor, but I would say the larger factor is the pre-existing structural and social conditions. So racism is not new in this country. I mean, Asian Americans haven't even been recognized as a formal racial group until in the 1960s, when Asian American actually occurred as a category in the US Census. So it's not necessarily just our individual level of perceiving discrimination that could be leading to these high suicide rates. It's a structural factor. It's the fact that historically we have had anti-Asian xenophobia occurring in the fabric of our society. And we're only now bringing awareness to it, but it could definitely be playing a role in the general, platform of suicide awareness.
So because there's an inevitable lag between what happens this year and how long it takes people in fields like yours to figure out the causes, the underlying causes, what can you safely say today are steps we can take, the country can take, individuals can take to get their mental health on a good track and kind of bring this number down?
Absolutely. I think it really just comes down to funding. There's a lot of barriers in terms of what kind of funding we're able to even get the answers that we're looking for. I mean, just to answer the questions that you're asking me, we need research. And research only really functions by getting the funding. I personally had a lot of struggle getting funding myself. So I can understand that it's very difficult that there are even structural barriers within the field of research to get at answers for these questions.
All right. A lot of important insights there. Amelia Noor-Oshiro, thank you very much.
Thank you.
If you or someone you know needs help, the National Suicide Prevention Lifeline Network is available 24 hours a day, 7 days a week. You can call their hotline at 1-800-273-TALK. You can also find them at suicidepreventionlifeline.org.